everyone, I'm Dr. Folu and we'll be talking today about sudden infant death syndrome. Sudden infant death syndrome is a very distressing and unfortunate occurrence where a seemingly healthy baby under the age of a year dies in its crib. This is fortunately not very common, but again, when it does occur, it is extremely distressing. Sudden infant death syndrome has been associated with a number of causes. First of all, babies who have been identified to have brain defects. Usually this is discovered after the demise of the child, so indeed the brain defect was undiscovered prior to the baby's demise. And this happens when the brain defect is in the area of the brain that controls or is responsible for respiration, and the malfunction of this area at that time is actually what leads to the demise of the child. Other factors include low birth weight babies who are born less than 2.5 kg with weight of less than 2.5 kg at birth are known to have increased incidence of sudden infant death syndrome. Babies who have respiratory tract infections are also known to be at increased risk of having sudden infant death syndrome. Now, other factors that could increase the risk include the sleeping environment of the child. For instance, babies who sleep in bed with others, such as their parents, their siblings, or even pets, are at increased risk of sudden infant death syndrome. Babies who sleep on their tummy, who are placed to sleep on their tummies or on their chests, especially when the crib is crowded or filled with soft and very fluffy beddings, are also at increased risk of sudden infant death syndrome. And babies who are kept excessively warm in their cribs, either using a room heater or even a crib heater, are at increased risk of sudden infant death syndrome. Now, there are also a number of risk factors too that can be associated with sudden infant death syndrome. For instance, mothers who are extremely young, babies that are premature, mothers who did not have antenatal care, or mothers who take a lot of alcohol or smoke cigarettes, and indeed secondhand smoke either of the mother or other person that is living in the house where the child is, increases the risk of sudden infant death syndrome. Some biological factors are also known to be associated. For instance, sudden infant death syndrome is commoner for some reason in male infants than in female infants, and it's commoner before the 4th month of life, at around between the 2nd to the 4th month of life. Not to say that it can't occur outside of that period, but it has been found to occur more commonly between the 2nd and the 4th month of life. Babies who are not Caucasians are also known to be at increased risk of sudden infant death syndrome. Now, what are the ways of preventing sudden infant death syndrome? Again, these go in line with the identified risk factors. So for that reason, we say that babies should be put back to sleep. That means that they should be laid on their backs or propped slightly to a side, either to the left or to the right, to sleep. Now, this does not negate the fact that there could be some periods where the baby can be placed on the tummy, the famous tummy time, but when this happens, there should be adequate supervision and it shouldn't happen for too long. Maximum amount of time at a stretch for tummy time shouldn't be more than 30 minutes to an hour, and this must always be with supervision. Babies should not be kept in crowded rooms. Babies should not be kept in excessively warm or heated rooms. If the weather is excessively cold, then babies can be bundled up appropriately with clothing rather than heating the rooms. Then Secondhand smoke should be discouraged. Mothers should be encouraged to breastfeed their babies and also to get all babies fully immunized. These have been known to reduce the risk of sudden infant death syndrome. Thank you.